The article, When is Accessing Medical Records a HIPAA Breach, addresses the requirement for only authorized personnel to have access to medical files. Access to the files is monitored by an audit log, according to DeSimone. The audit log helps to maintain the security of medical documents. Specifically, the article highlights an example of employees at a hospital viewing medical records out of curiosity, even though they did not have permission to see the patient's medical information. This resulted in them getting fired. The patient who sought out treatment did not deserve to become a case that entertained the nurses. Patients should feel safe to receive care without fear of judgment. Nurses should have their patients' well-being in mind and should not do anything to compromise their privacy. HIPAA stands for Health Insurance Portability and Accountability Act. It serves to help protect sensitive patient information. The ethical concern in this article is a HIPAA breach. The patient's medical records were violated. HIPAA policy does not allow unauthorized access to medical records. A breach is defined as the acquisition, access, use, or disclosure of protected health information in a manner not permitted. The main goal of HIPAA is to protect patients' privacy and medical information. The consequences for not doing so can be detrimental to the professional's reputation and the patient's privacy. Having a comprehensive understanding of HIPAA is crucial as a healthcare provider. Autonomy means that you respect the patient and their right to decide who can access their personal health information. When a HIPAA breach happens, this right is violated and an unauthorized person is viewing their information without their consent. Another ethical problem that's involved in a HIPAA breach is fidelity. According to the textbook, this is the faithfulness and the practice of keeping promises. Nurses have an ethical responsibility to act in the best interest of their patients. This means that they should work to protect the patient's private information. In addition, non-maleficence requires healthcare providers to avoid harm. A HIPAA breach would lead to various forms of harm to the patient. In addition, beneficence aims to promote a patient's well-being. When a HIPAA breach occurs, the patient's private health information is exposed. In addition, the American Nurses Association Code of Ethics defines confidentiality as the non-disclosure of personal information that has been communicated within the nurse-patient relationship. Provision 3.1 of the Code of Ethics says that the nurse has the duty to maintain confidentiality of all patient information, both personal and clinical, in the work setting and off-duty in all venues. The article talks about the consequences for violating HIPAA policies. This can include the loss of a nursing license, fines, loss of job, prison time, or exposure to litigation. According to DeSimone, individuals who knowingly obtain or disclose individually identifiable health information in violation of the administration simplification regulations face a fine of up to $50,000 and or imprisonment up to 1 year. The penalty can be increased to a $100,000 fine and or up to 5 years in prison for violations committed under false pretenses. Finally, offenses committed with intent to sell, transfer, or use individually identifiable health information for commercial advantage, personal gain, or malicious harm permit fines of up to $250,000 and or imprisonment for up to 10 years. Therefore, medical professionals should be held accountable for their actions. If you hear or see a healthcare worker violating HIPAA, you as a fellow provider have a responsibility not only to your own personal morals, but to your patients as well. You have a duty to speak up and advocate for your patient. According to the Code of Nursing Ethics, provision 4.1, it says nurses are responsible for delivering competent, compassionate, person-centered care within their scope of practice. Nurses are accountable for fulfilling their ethical responsibilities. This includes choices to take or not take action. Nurses are always accountable for their judgments, decisions, and actions. The choice is yours. What kind of provider will you be? Will you be the provider that advocates for your patients or the one they need advocating against?